With regards to diabetes and high blood pressure, of course, stimulant medications, we're always concerned about blood pressure. And so we do want to see that under control. There are some medications we can use for ADHD off-label that can actually be beneficial for blood pressure. So propranolol, also named Inderal, we see blood pressure actually improved with this drug, and it does help with some mild to moderate symptoms of hyperactivity in patients. What's really interesting is this drug treats a lot of other conditions. It also treats migraine headaches. It helps with stage fright or situational anxiety. Many of our patients with ADHD struggle with some emotional regulation, and their blood pressure issues are what I call reactive. So you get that upsetting phone call, someone rattles your cage, your blood pressure skyrockets. Propranolol can be tremendously helpful in this group of patients. So, the goal in medicine is always to give as little medication as possible while covering, as many conditions as possible. The other thing with stimulants with regards to diabetes is it can affect diet. And so some patients who describe themselves as grazers throughout the day, they just snack all day long. With stimulant medications, the appetite can be decreased. You may actually find some improved control in diabetes. The caveat to that is our insulin-dependent diabetics. So those patients should be eating 3 meals regularly throughout the day. They should be monitoring blood sugars, snacking when necessary to correct low blood sugars. In patients that have an altered appetite as a result of stimulants, they'll need to be more purposeful about monitoring their blood glucose levels and then eating and snacking as appropriate. The last thing is, there are some other non-stimulant medication options that we can use. They don't affect diabetes or hypertension directly. They're just, meds that just kind of do their own thing. Wellbutrin would be an example of that. Strattera, sometimes we can see some issues with Strattera. I think that's a case-by-case basis for patients. Wellbutrin, veering back to that one, most of the time I don't see a huge appetite change with that one. Sometimes a slightly decreased appetite, again with diabetes, but not nearly the same effect as stimulants. And so I comfortably use that with patients. Side note with that one also, it's also labeled for nicotine dependence. So if you're a diabetic hypertensive patient that's smoking and you also have ADHD, Wellbutrin is a great option as well. And this is really what differentiates a good doctor from a great doctor when it comes from ADHD, is knowing each of these drugs in great detail, what they do, what they're labeled for, what they're used off-label for, to give you your own personalized regimen that's effective and safe.